This video is about one of the more unusual causes of wrist pain. In fact, it accounts for less than 1% of all wrist pain, and as such, it's often misdiagnosed or just not diagnosed at all. So if you have symptoms of pain and sometimes a grinding sensation directly over this area of the wrist right here, well, you might just be one of those rare cases where you have a problem with your pisotriquetral joint. And I know what you're thinking. The what joint? Well, keep watching and you'll learn all about it. It's a great name, isn't it? And it refers to 2 of the 8 small bones which make up the wrist. Here they all are. They sit in 2 rows. The distal row, which connects to the bases of the thumb and the fingers, and consists of the trapezium, trapezoid, capitate, and hamate, and then the proximal row, which connects to the forearm bones, the radius and ulnar, and consists of the scaphoid, lunate, and then our friends, the triquetral and the pisiform, which connect to each other to form the pisotriquetral joint. So of course this is a small joint. The pisiform is about the size and shape of a garden pea, and indeed the name pisiform is derived from the Latin name pisum, which means pea. You can feel the pisiform bone just here on the palm side of the wrist. It feels like a small marble. And whilst I said it's shaped like a pea, one side of it has a scooped out facet, which is where it sits on top of the triquetral bone to form the pisotriquetral joint. The pisiform acts as the attachment point for an important muscle called flexor carpi ulnaris, or FCU for short. This is one of the strong muscles which flex the wrist, and its tendon uses the pisotriquetral joint as a fulcrum in order to help it work more efficiently. It works in a similar way to the kneecap. Here, the patella bone acts as a fulcrum for the tendon of the quadriceps muscle by re-angling it so it can pull more efficiently on the tibia and therefore straighten the knee more effectively. Like any synovial joint, the pisotriquetral joint can succumb to osteoarthritis, and that's the most common problem that we see. The normally smooth layers of cartilage, where the pisiform and triquetral bones connect to each other, can become roughened and degenerative, eventually causing pain, and often a grinding or grating sensation as the 2 bones move against each other. The other problem that can occur is after a wrist injury, which sprains or tears the ligaments that connect these 2 bones together. And this can lead to instability. So basically, the pisiform becomes wobbly and moves around too much when the FCU tendon pulls on it. Having an unstable pisotriquetral joint will feel like there is something moving around in the wrist, which shouldn't be, and that's pretty much exactly what's happening. And eventually, if the ligaments don't heal and the instability persists, then this can lead to arthritis of the joint. So if you have arthritis or instability of your pisotriquetral joint, then you're going to have pain right here, particularly when flexing your wrist like this. You might also feel pain when leaning through your wrist like this. The clinical test we use to check for pisotriquetral problems is the pisotriquetral grind test. A clinician will pinch hold of the pisiform with their thumb and index finger. They then flex the wrist, which takes tension off the FCU tendon and allows them to move the pisiform from side to side. And while wiggling it like this, they then push it downwards into the wrist, essentially grinding it against the triquetral bone underneath. Any reproduction of the patient's familiar pain or their grinding sensation is considered a positive test. You can also compare the amount of side-to-side movement of the pisiform to their other wrist, and if the joint is unstable, then there might be excessive pisiform movement on the affected side. The other diagnostic test is going to be some form of imaging. Usually an X-ray can pick up osteoarthritis. Here you can see the roughened surface on the back of the pisiform, which is classical of arthritis. In instability, you're going to need to image the ligaments, and so an MRI scan or an MR arthrogram is the best option. Well, if you've injured the pisotriquetral joint, commonly by falling onto your outstretched hand, and you've developed some pain and maybe some swelling around the joint, or perhaps some symptoms of instability, then the best treatment is to immobilise the joint for 6 weeks or so in a splint, so that those injured ligaments can go through a healing process. A simple wrist splint like this is often all that's needed, unless your injury is more severe, and in that case, an orthopaedic department might put you in a cast for 6 weeks. Anti-inflammatory tablets or a gel might also be helpful for the pain. If your problem is osteoarthritis, then using a splint or a short course of anti-inflammatories can also be helpful, particularly if symptoms have just flared up and you're just trying to calm them down to a more manageable level. But if it's more of a chronic arthritic problem and the symptoms are persistent and ongoing over the long term and splints are no longer helping, then you might need to see a specialist. The next treatment step would usually be a cortisone injection. This can be very helpful in calming down an irritable arthritic joint. And if you can then avoid annoying it again by not leaning through the wrist too much, or by avoiding doing any repetitive wrist flexion activities like racket sports or painting or using a screwdriver excessively, that sort of thing, then an injection might last a good long while, or it might even be a permanent cure. But if not, and the pain is a real problem for you, then the last resort option is going to be surgery. And by far the most common procedure is to remove the pisiform completely, something called a pisiform excision. This often works very well, as people can usually manage without a pisiform without many issues. Wrist flexion strength is going to be a bit weaker, but that's usually a small price to pay to get rid of the pain. Okay, so that's pisotriquetral joint pain all wrapped up. I do hope the video has been helpful. Thanks very much for watching, and bye for now.